Greetings to all our listeners. Welcome to the H3 Pink Ribbon podcast. Our mission is to inform and support breast cancer patients, survivors, and their loved ones regarding the latest information and resources related to breast cancer diagnosis, treatment, and the navigation of long term survivorship. This day marks our very first episode. We'll talk about how I founded H3 Health, Hope, Healing. I will share about its humble beginnings as a breast cancer support group. I will reflect on H3's evolution and how its growth in the South Florida community has led to many accomplishments, including several awards and presentations along with nationally recognized breast cancer organizations. Joining me as a special guest for this episode is someone whom I often refer as a walking miracle, the personification of health, hope, and healing. I hope you all enjoy our show today. My name is Janinha Piazzetta. I am an 18-year breast cancer survivor, and this is my breast cancer recovery story. During my treatment, I saw many gaps in the medical system according to my needs as a patient. As a newly diagnosed patient, I had many unanswered questions and unmet needs. It was my desire to fill those gaps that led to the founding of H3 Health, Hope, Healing, a nonprofit educational organization based in Miami Beach, Florida. The mission of H3 is to provide breast cancer education, awareness, and support. As I mentioned before, today is the first episode of our Pink Ribbon podcast, created with the hopes of providing timely education and support about breast cancer to an even wider audience. Each woman's story is different. Every woman's experience is unique. This is my story. I was diagnosed with a 5 centimeters ductal carcinoma, breast cancer, stage 2. When the surgical oncologist presented my options, mastectomy versus lumpectomy, I was confused, very confused. I asked what the percentage was from one to another in terms of recurrence and survival. The answer at the time was 15 to 20% between one and the other. I chose the one I thought would be easier, lumpectomy, local surgery to only take out the cancer, followed by the chemotherapy and radiation. The idea of taking my breast out and have to wait a year for a replacement did not appeal to me. That was the hospital protocol at the time. In my mind, I felt it was already difficult to walk around with two breasts. Imagine with only one. In retrospect, I don't think it was the easier choice. Chemo was hell. Like most of the women in my situation, I experienced many side effects: nausea, pain, depression, lack of energy, partial hair loss, bone issues, and a decrease of libido because the hormones were just not there. On top of everything, I became menopausal by the second session of chemotherapy. My personal experience during the breast cancer treatment led me to becoming a pioneer about openly speaking about sex after a breast cancer diagnosis and subsequent treatment. As a result, I produce many lectures and workshops about sex after breast cancer treatment with our nationally recognized South Florida sexologist, Dr. Marilyn Volker, to help women cope with the physiological response to breast cancer and its treatment. In my opinion, breast cancer is among the toughest of cancers for women. It changes our physical appearance in many ways, even post remission or cure. However, the ordeal made me stronger and more accepting of things in life that I could not control. I became more centered, more spiritual. Somehow it woke the warrior inside of me, inside of every woman. It's beautiful, isn't it? I am sure that many of you out there can relate to this warrior's wokeness. Although I had some threats here and there, today there is no evidence of recurrence. I attribute my recovery to my trust in the universe. I kept moving forward, trusting that the universe was and still is behind me. I had that force, that strength that kept me going and going. And the universe conspired in my favor and never let me down. Hey, I am lucky. I am thankful for my breast cancer journey and its positive outcome. And that's why I dedicate my time to H3's work to help other women going through their breast cancer ordeals. That's my personal journey. Our second segment of today's Pink Ribbons podcast is very, very special. Our special guest today is my dear friend Lisa Blumetti, who has survived stage 4 metastatic breast cancer for 16 years. She's also the chairperson of H3 and an amazing friend. Lisa, I have known you for 16 years. I first met you when you came to our breast cancer support group at the Miami Beach Regional Library. I believe we connected from day one. Yourself, your story, and you as a special female figure. But most of all, your personality, your core, your integrity, and your journey as a 16-year breast cancer survivor with metastases to the lymph nodes and bones. It's an honor to have you today in our inaugural episode and as our first guest. Lisa, welcome to our Pink Ribbon podcast. Why don't you tell us a bit about yourself before we get into the questions?
Absolutely. I am honored to be here. Thank you, Janinha. And I think this is a great thing you're doing, the podcast. I love the way you've transitioned from a support group into everything else that you bring into the community. And I just want to start by acknowledging something you said about feeling lucky. Chemo was hell for you, and the journey that we've both been on, you even longer than I have. I used to joke the first year after I was diagnosed, after all the surgeries, I used to kind of make this joke that breast cancer sucks, but at least I got the boob job I never wanted. And, sometimes I make light of things and sometimes joking about it is the best way to deal with it. But the reality is we're both pretty lucky because there's a lot of women who didn't win their battle. There's a lot of people who didn't get through it. And so,
Amen.
Congratulate both of us. We're still here, still fighting, still kicking, which brings me to another point about survivorship before I get to my story. Women out there listening, anyone listening, you're not a survivor after you start treatment or after you're through treatment or during your treatment. You're a breast cancer survivor from the moment you're first diagnosed, because that's when the battle starts. So my battle started officially in September of 2006 is when I was first diagnosed. But unlike a lot of women, it wasn't really a surprise to me. I knew I had cancer when I went to the doctor. And, Janinha also mentioned that every woman's story is different and everyone's story is unique. And I think that's a little bit of what makes my story unique, is because it wasn't a surprise. I think a lot of women go to the doctor, you go for your yearly exam, you get your mammogram, you go in expecting to be perfectly healthy, and then all of a sudden, your oncologist finds this microscopic growth in your breast that turns out to be breast cancer. And it's really, really shocking and really scary for a lot of people. And that was not my personal experience. I had my first mammogram when I was about 22. As it turned out, I had pretty cystic breasts when I was younger. And, I had some fibroadenomas, and I would get them checked, and I'd have mammograms and MRIs and attempted aspirations, and nothing ever worked because fibroadenomas are solid. So they couldn't be aspirated. So I'd get one and I'd get it checked out, and I'd get another and I'd get it checked out, and I'd get another and I'd get it checked out. And, as a young person without insurance, you end up spending an awful lot of money getting things checked out when there's nothing wrong. So by the time I got my fourth one, I just kind of poo-pooed it and figured, okay, it's just another fibroadenoma. I'll let this one go too. And then after a couple of years, it changed. The way it looked changed. It was involving my skin. And I realized, like, holy crap, I got to do something about this. So I went to the doctor. And, you have to jump through all the hoops, even if you know what you have. I knew I had cancer, but, you have to do what the doctors tell you. I had to get my biopsies. I had 7 biopsies. I had to have an MRI. I got a PET scan. And the doctors just told me what I already knew. I had breast cancer. But when I was first diagnosed, he thought it was just one mass and he could possibly do a lumpectomy, which was not the case. I had 2 masses, which no longer qualified me for a lumpectomy. So I had to have a mastectomy, which is what I did, just on one side. I make another joke that I used to have the best tits in town, but one of them was trying to kill me. So I had to get rid of her. And that's what I did. And that
I'm glad
was...
that you did.
And, so when I was first diagnosed, I also kind of thought, well, I can beat this on my own. My mom was a bohemian hippie, and, we went to the doctor when we had to, but we didn't over-medicate or medicate unnecessarily. And, I thought, I'm young, I'm strong. I was a couple months shy of my 38th birthday, and I was as fit as I had ever been. And I figured, okay, I'm going to order some bizarre botanical concoction from the Brazilian rainforest, and I'm going to inject it into my thigh every day, and I'm going to take sublingual drops, and I'm going to scare this cancer out of my body. And that was really not the smartest approach, because if I had stayed on that path, I probably would have died from breast cancer instead of now the greatest likelihood, as far as I've gotten, I will probably die with breast cancer, not from breast cancer, which is a very big difference. So I got my first surgery in February of 2007. I had about 6 surgeries during the course of 1 year. And it was brutal, some of it, some parts worse than others. And, sometimes very discouraging because, your treatment path and your surgical path can be really straining on a body that you're accustomed to having it be able to do anything. And all of a sudden you feel like you can't do anything. So yeah, I've been in active treatment since March of 2007 was my first treatment. And I've been going every 3 to 4 weeks since then. And, the cancer had spread through my lymph nodes. I had 24 lymph nodes removed during the first surgery, 17 of which were positive for cancer. And it also spread to most of the bones between my hips and my shoulders. So I had a really great oncologist at the time, and she suggested that instead of exposing my entire body to the toxicity of chemo, let's try something a little more targeted because I had very specific tumor markers. So that's what I did. And I'm basically still on the same treatment 16 years later. And if it ain't broke, don't fix it.
So, what is your current cancer diagnosis or typical prognosis?
So I was originally diagnosed, similar to you, with ductal carcinoma. The first initial diagnosis was not stage 4 because at that point they hadn't realized that it had spread through my lymphatic system into my bones. And technically, my understanding is that as soon as it spreads, as soon as you have any sort of metastases, you jump straight to a stage 4 diagnosis. So, during the time of originally being diagnosed in September of 06 to starting my treatment in February of 07, I went from probably what was maybe a stage 2 to a stage 4. And as far as a typical prognosis, I have no idea. I honestly don't know. It's hard to say. What I do know is that as a young woman, when your hormones are still raging and everything works in your body and you have hormone positive cancer, it does tend to be a little bit more aggressive. So that can be a little bit dangerous, but there's very good targeted treatments for that. So I think that worked in my favor. And again, as far as typical prognosis, it's really hard to say because I don't know that I'm actually curable. I'm treatable because there will always be evidence of disease in my body. If I have a PET scan now, there may not be hypermetabolic activity, but there are sclerotic lesions that you can see in my bones. And also, there's just not a whole lot of studies with people like me. There's not a whole lot of breast cancer patients out there that I'm aware of who have been in active treatment for over 16 years with no progression of disease and no change in treatment protocol. So I'm sorry, but I don't have a good answer for that question.
We have to do something about science,
Yeah.
scientists, researchers, and see your case because it's very unique.
Yeah, I mean, I'm sure there's other people out there like me. You know, I can't be the only one. But I don't think there's a lot of people who've had literally no change at all. There's plenty of women who've survived breast cancer longer than I have. There's plenty of women who've been in treatment as long as I have. But I don't know that there's a great number who've had no change in their treatment ordered by their doctors, you know, because oftentimes you start on one drug, it works for a while, there's a progression of disease, or either your body doesn't tolerate it any longer and your oncologist will change you to something else. And that just hasn't happened for me. I've taken myself off a couple drugs because I didn't want to deal with the side effects anymore. But other than that, I'm doing the same thing I've been doing for 16 years.
So, what is your treatment right now? Has it changed over time?
No, it actually hasn't. So, like I mentioned, my tumor markers are very specific. I'm ERPR positive 100%, which means that, you know, my cancer is very stimulated by hormones. And I'm also HER2 positive +3. So +3 is the highest you can be on the HER2 scale, which means that I was I qualified to take a drug called Herceptin, which is what they give you when you're HER2 positive. And I've been on Herceptin for 16 years, which again is kind of unusual because the standard protocol, if you're HER2 positive, I believe if you pair it with chemo, most oncologists keep you on it for a year. If you do it as a single agent treatment, you can do it for up to 5 years. The doctor who discovered the drug only keeps his patients on it for 3 to 5 years. So I don't know why I'm still taking it, but it still works, and there's been no progression of disease, and I tolerate it. It's a much easier treatment to tolerate. I know, Janinha, you had standard chemotherapy, which
Yes.
it's literally, chemo works by poisoning the cancer, but it also works and it poisons your entire body. It poisons everything, and that's why the side effects are so harsh from
Well, if
traditional
I
chemo.
really look back then, I think also radiation was hell.
Yeah. I mean, I never had radiation either. And from the women I know who've had radiation, it exhausts you. It can be, yeah, it drains you, but it doesn't expose your entire body to the toxicity like the chemo does.
Chemo does.
And that's
Yeah,
really what
that's
does
true.
it. So, you know, I have been lucky in that sense that I was never on a standard chemotherapy agent. I was only on Herceptin, which is also good because Herceptin can affect the left ventricular function of your heart, but more so when you pair it with chemotherapy. And since I was never on chemotherapy, it hasn't done any real noticeable damage. I do have to have an echocardiogram every 6 months, or the pharmacy won't give me my drugs. And it's been okay. It really hasn't, you know, my ventricular function hasn't changed really in over 15 years.
I am glad.
So am
Very glad.
I. So am I. Because, you know, when parts of your heart stop working right, that's not good news for anything.
So, Lisa, what strategies have you used to become a long-term survivor with metastatic breast cancer? Tell us.
Tell you. My key to success. You know what it is.
Well,
Apathy. I simply don't care. I try to keep my view of my own life in a global perspective. And the reality is, you know, and this isn't to belittle anyone else's experience, you know, everyone has a different battle and a different experience and feels things differently. And I feel things very deeply for other people, but I don't feel them that deeply for myself. So I never really got upset. I mean, yeah, listen, like I said, cancer sucks. There's nothing good about it, but we're still here. We made it through. You know, you make good friends, you meet great people, and, you know, it's just another experience in life. But again, I never, I never had that, crying time, the why me, why me. I never felt bad for myself. Like I said, there were a few moments when I was very discouraged by what I couldn't do physically because I had a pretty invasive reconstructive surgery where they removed my entire latissimus dorsi muscle from my back and a patch of skin and moved it all the way around to the front of my body to rebuild a breast, basically. And, for weeks, I couldn't even pick up my right arm, like literally could not move it. And, for someone who is super fit and super strong and, thought I was invincible physically to not even be able to brush my teeth or wash my hair or, do anything. It was really like frightening, but really discouraging. But, it came back, the power comes back. You just have to do a lot of rehab and you really have to stick with it and keep exercising. So, I guess it's attitude. Everybody has moments where they just melt down and get really sad. And I mean, everybody has those. You get angry, you get sad, you have your little pity parties, and that's fine. Everybody has to do it. It's a good way to recharge, and then just get back to life, get back to normal. And, you know, I do think everyone who knows me hears me say this all the time. Every day I leave my house, I see someone I wouldn't want to trade places with. And as long as that keeps happening, I can still keep leaving the house.
Hey, man. Also, what do you attribute to your long-term survival? It must be a few things that you are using, you are doing that it's working.
Yeah, I think staying fit and being as healthy as I can. I mean, I'm a vegetarian, but I was vegetarian way before, I got a breast cancer diagnosis. I stopped eating meat when I was 17. But back then, all the meat alternatives, everything was soy based, soy, soy, soy. And, soy is a phytoestrogen. So, you're filling your body with soy chemically, it's being recognized as an estrogen source. And, as a crazy young kid, of course, I was on birth control pills, which is really just screwing up all the estrogen and hormonal levels in your body too. So yeah, I probably gave myself cancer. Maybe that's why I never got angry at the universe, because I did it to myself anyway. But, all kidding aside, I do think diet has a big part to play, just overall physical fitness. Luckily, I never even had to deal with lymphedema, which is something a lot of breast cancer survivors have to deal with, mostly because of, when you have your lymph nodes removed, it messes up your whole lymphatic system and the drainage. And, they told me way back when it generally tends to be people who have a more sedentary lifestyle who get affected by the lymphedema. So I said, screw that. It's not going to happen to me. And I never stopped moving. I exercise, I stay fit. I do drink socially most of the time. But, I do wholeheartedly believe that what you put in your body and what you put on your body makes a difference. As far as produce, I only eat things that are organic because all the pesticides and herbicides and all the chemicals they use, they are known either carcinogens or endocrine disruptors. And when you have female cancers that are hormone driven, you screw up your endocrine system, it could possibly lead to, cancer issues down the road. So I do think it's really important. And also people seem to forget that your skin is your biggest organ. So if you're smearing all sorts of chemicals on your body, and, we live in South Florida, people are putting sunscreen on all the time. There's a lot of chemical sunscreens that I don't use either. If it's not zinc or titanium, I don't put it on my body because, everything you put on your skin gets absorbed into your skin. So just be a label reader, pay attention. It's not rocket science. If you can read, you can figure this out. You just have to be smart. That's all.
Excellent, excellent. So tell me, is there something else you do compared to when you were first diagnosed?
You got a time machine?
Not yet.
Yeah, as soon as someone invents a viable time machine, I'd probably go back and change a lot of things.
Such as?
Well, don't get me, we don't have time for that. We'll keep this cancer focused. So when I was first diagnosed, like I said, it was 2006. This was before, everyone had handheld devices and there was no social media. It's back when people would look things up in the newspaper. And I was living in Hollywood, Florida at the time. And I looked for a support group that I could go to because I didn't know anyone with cancer. I didn't know anyone my age with cancer. And I found a local meeting that met once a week. And I went into the room figuring I would look for advice. I didn't feel like I needed support because I wasn't emotionally affected by it, but I needed advice because I didn't know what to do. I didn't know which surgeon I should go to. I didn't know which oncologist I should go to. And like I said, at the time I was at first diagnosis, I was just, a couple months shy of my 38th birthday. And one of the things I noticed when I first walked into this room was I was pretty much the youngest person there by at least 15 years. So it's me sitting around a table with all these women who are, my mother's age or older. And I'm telling them, about my surgical options and my treatment options. And the one thing that really stood out was they all thought my surgeon was so cute. They just said, listen to him. Oh, he's adorable. He's adorable. Do whatever he says. And I'm thinking, I'm not looking for a boyfriend. I'm looking for a competent surgeon. And at the time, they were sort of starting to implement this latissimus back flap surgery where they would take your lat muscle and move it around to the front. And I was pretty thin at the time. I needed some extra skin because of the skin involvement where my tumor was. And the surgeon said, this is what we should do. So I said, okay, we'll do it. I figured he had experience. I didn't. It was it was a long surgery. I think my first surgery was about 6.5 hours, and I had about 6 more surgeries in the following year for revisions and changes that needed to be made. So looking back, I've pretty much recovered from it. There's certain parts of my body that I'll never have the strength in again, because when you don't have your lat muscle in your back any longer, there's just things just don't, physiologically you'll never be able to do. So if I could do the whole thing over again, well, first of all, I would have gone to the doctor years earlier because, stupid me, I waited. If I had gone earlier, I probably wouldn't have had metastatic disease. I wouldn't have been stage 4. I probably would have had chemo. I probably would have been cured. But, coulda, shoulda, woulda. I did what I did. I can't, like I said, we don't have a time machine. I can't change anything. So I just have to accept what I did. But I don't necessarily know that I would have had the back flap procedure. I might have just had a basic reconstruction and ended up with smaller breasts. Like I said, I kept one of my breasts because it was perfect. And I wanted the new one to match the size of the old one. So I don't know. Things change. We get older. You can't regret what you've done because I can't go back and change it. So
I like this approach, your approach. So, Lisa, thank you very, very much. Listening to your story and detail makes me admire so much more about your journey as a breast cancer survivor. I wish you good luck and continued success in your journey.
And yours as well.
Thank
Success
you.
to both of us and everyone listening. Success to all of you. And please be proactive about your own health.
As you see, we all have our unique journeys and experiences related to breast cancer. If you need more information about H3's work, please visit our website, h3hope.org, or email us at info@h3hope.org. Share your story and concerns. We are here to help. Stay tuned for our next exciting episode with another walking miracle, Judy Perkins. Judy was basically dying of breast cancer when she sought out an immunotherapy clinical trial. As a result, she cured her breast cancer. An amazing breast cancer miracle. H3 Pink Ribbon Podcast will air our second episode on Friday, December 9, 2022. Stay tuned. In addition to our Pink Ribbon Podcast, in the next few days, we are launching the H3 Virtual Pink Ribbon Support Program. This program seeks to offer unique support, encouragement, and valuable information as patients navigate through their treatment choices and options. It's extremely important to have the support of a breast cancer organization while going through the cancer treatment ordeal. And support us next Thursday, November 17, at Give Miami Day event. Give Miami Day is one of the nation's largest annual giving events. The 24-hour online giving campaign makes it easy for everyone to become a donor and champion their favorite causes. Give online all day from anywhere. Just visit givemiamiday.org and search for H3 Health Hope Healing. Thank you all for listening to our Pink Ribbon Podcast. Stay safe, happy, and healthy, And in advance, happy Thanksgiving. I wish you health, hope, and healing.